Welcome back, everyone. Today is World IVF Day, a day to recognize the progress made in fertility medicine since the first baby was born using in vitro fertilization in 1978.
And now, 4 decades later, more than 8 million babies have been born worldwide thanks to advancements in IVF technology. In the U.S., about 2% of babies are born with IVF. Joining us now is fertility expert Dr. Asima Ahmad, head of Carrot Fertility. Good morning, and thanks for being with us.
Thank you for having me. Excited to chat with you today about this really important topic.
Now, we always appreciate the experts joining us here. Let's start with the advancements. Have there been any recent developments in IVF that you think are important to note, and how are you seeing the treatment evolve now?
So one thing that's really important to note is that IVF continues to advance. It's been around for 40 plus years. And one really important advancement over those last 40 years is that the quality of the embryology labs continues to improve, so that before, when you had to transfer 2 or 3 embryos to have success, you can now transfer 1 and even have a higher success than back in the day. The other thing that continues to advance is the genetic testing, and I get really excited about this. There's more genetic testing options that are available, and there are new techniques that are being evaluated so that the risk of damage to the embryo during that process when they do the biopsy can be lower, so that there's minimally invasive and also other non-invasive techniques that are being evaluated.
So, we know IVF can be really expensive, especially here in the U.S., where it can cost $20,000 to $30,000. I know more and more women, couples are seeking fertility care abroad because it is cheaper. So why is this way? What would you like to see happen to make it more affordable? Is that even something that's possible down the line?
I absolutely think there are things that we can do to make it more affordable. And to start, yes, IVF treatment is expensive. A lot of medical treatments are expensive, but it's the affordability factor. It's that in many cases, about 80+% of people have minimal to no coverage when it comes to IVF treatment. And so one way to help improve access to that is to have employer-sponsored benefits. So that's something that we do at Carrot Fertility, so that financial burden is taken off that individual. Because if you look at the numbers, 1 in 6 people globally have infertility, and even more people need to do fertility treatments to be able to grow their families. So it's definitely something that needs to be covered.
Do you think we could see the access to IVF change when it comes to healthcare and those offered by your employer?
Absolutely. We are seeing more and more employers providing fertility benefits to their employees. Our customer base, for example, has increased year on year from 2020 to 2023. And employers see that value to being able to provide those fertility benefits to their employees. It helps them recruit that high level and retain that high level talent. And if you look at the data, for example, 9 out of 10 of our Carrot members say that they would stay with their current employer because they offer fertility benefits. And a survey that we did recently show that over 60% of people would consider switching their jobs to be able to work with an employer that actually covers fertility care.
We are in a tenuous reproductive rights climate right now nationwide, and there have been increasing arguments from lawmakers and anti-abortion activists to ban IVF because they argue frozen embryos could be destroyed. So what are you and your colleagues hearing about these efforts, and are there any sort of contingency plans happening if states start to ban the procedure?
I think those are all very great questions, especially given that this is an election year. But what I see overall is that most people are supportive of IVF. Like you mentioned, over 2% of babies that are being born now are as a result of IVF. Some data says 8 million babies, some data says 10 million babies, but in general, a lot of people are using IVF to grow their families. And so there is a lot of support across the world when it comes to being able to access this treatment. So I think there is a lot of conversation around IVF and embryos and frozen embryos and what that means. But we at Carrot remain deeply committed to being able to offer fertility coverage benefits to people across the world. We cover millions of lives globally, but also as a care provider, as a fertility doctor and someone who does this every single day, there are many people out there that are fighting to be able to continue being able to provide this care to people.
All right. Thank you so much, Dr. Asima Ahmad of Carrot Fertility. We appreciate your time and just sharing your perspective from the treatment side of it. Thank you.
Absolutely. Thank you for having me.